Hello, good day, everybody. It's David Nabarro speaking to you. I'm delighted to be with you today. This is the latest in our series of open online briefings on the COVID-19 pandemic, where we just take a look at the latest trends, and we also explore some of the challenges that are being faced by governments, by businesses, by civil society, and most importantly, by people everywhere. What we try to do is to draw on the guidance that's being provided by the World Health Organization and link that to the realities of what's going on in different settings and try to interpret that guidance. And usually I start with a short introduction and then we move to an opportunity for questions and answer. And that format seems to be working quite well. So that's what we propose to do this time today. But I want to tell you first the themes that I'm going to focus on in the next few minutes. Firstly, what are the elements that are necessary for governments to be exploring how to come out of lockdown when they have got lockdown as part of their containment strategy? Secondly, what are the challenges being faced within very poor countries with enabling the outbreaks of COVID-19 to be contained, and how is it going to be possible for the rest of the world to provide support to poorer countries at this particular time and leading into the future? And then thirdly, how are the challenges related to COVID-19 impacting on people's food security in different parts of the world, and what might be done about it? The first thing on lockdown. First, we need to just remember why lockdowns are imposed on populations. What's tended to happen is that there are really two kinds of lockdowns underway. The first, and one with which many of us in Europe are familiar, is the lockdown that is imposed as part of the effort to try to suppress outbreaks that are really very large in order to try to prevent the overload of health services and also to try to reduce as much as possible the distress in the population. It's kind of letting the pressure out of the outbreak. And how is it done? Basically, as the numbers of cases rise, governments realize that they need to reduce opportunities for the virus to be transmitted from person to person. And they tend to impose their lockdowns a little bit gradually. They start by asking people to stay at home, and then they actually impose the stay at home, and then finally they make it really, really difficult for people not to stay at home. And in France, we've been through this, and that's why I'm conscious of it, with now major fines for people going out and really tough restrictions on how long you're allowed to go out of your house for, plus the closure of recreation areas, nice walks are being blocked off and the like. And that's very much a reaction in this country to a sense that the virus was moving into far too many locations and was really becoming very, very tough to control. And so a strong lockdown was imposed as part of the containment strategy. But there are other countries where lockdown has been put in place quite early when there are only a few cases. And those include India, they include South Africa, and they include many other developing countries. And that's a very rational response to the reality that when you haven't got a very strong health system, and you really are worried about ensuring access to what little health care you've got, plus you haven't got strong public health services, an early lockdown gives you a bit of time to put things in place. And that's very much what's been done. But then, of course, there's an anxiety there. When do you decide that things are good enough for you to be able to release the lockdown? And how do you prevent a really unfortunate rebound in cases that might then overload the system and make it very hard then to avoid putting back a lockdown with consequences that are extreme. And so these early lockdowns, particularly in poorer countries, really have to be as short as possible. Now, in trying to work out how to come out of lockdowns, governments, I think, have to be thinking all the time, what is the new normal going to be like? As a colleague said to me this morning, it'll probably be more new than normal. And quite simply, that's because life living with the virus, because the virus isn't going to go away just because we've deflated some of these big outbreaks in the UK or the US or France or Spain. It isn't going to go away when India has managed to settle things down. It's going to stay with us, and it's going to be being transmitted among people, and it's going to be hard to track because, as you all know, there are quite a lot of people who get the virus who don't get very ill, but they can still infect other people very easily. So handling all this and all the challenges of the new normal and trying to restart the economy and also enable people to re-establish their social connections is going to be tough. And so much of the time is spent thinking about what does a government need to be sure of in order to be able to restart the economy after a lockdown? What are the things that really matter the most? And there, I think, there are two vital requirements. One is the capacity in communities everywhere to be on the alert and to be able to detect people suspected of having COVID and to get them to isolate themselves and to provide all the support necessary. Kind of swarming to wherever there's a little mini outbreak starting and closing it down. And we do know really well that if you can do that and do it reliably, you don't have these great big outbreaks. You don't need to have long periods of lockdown. It becomes a new normal of being able to detect and then contain and do it super fast and go on doing it and go on doing it and go on doing it. It's going to be, as somebody described in an article I read recently, like something called whack-a-mole, which is a game where things pop out of a board and you whack them. Well, it won't be quite as violent as that, but it is going to be about being ready to suppress new little outbreaks wherever they appear. This is going to require quite a lot of remodeling of our societies. So what I'm feeling all over the world now is very serious thinking of what is that social fabric going to be like, and how will we be able to engineer the new normal so that on the one hand, it's possible to identify people with this disease, which has certainly quite specific symptoms, but they might be very mild on the one hand, whilst at the same time enabling the normal freedoms that we've all, in most countries at least, got so used to be sustained. So that's number one that I'm looking at, thinking about, and we're just about to release a narrative on it today, in which one of our team posed 7 questions and others tried to think through how do you answer those questions, and realizing this is just a really tough one for every single decision maker everywhere. And one thing that Tedros of WHO said yesterday, you really have to have unity within a country when you're doing something like this. But if you get one city saying, oh, we're going to have a really good new normal that's going to be inside the city, and this is what the structure looked like, and this is how we're going to do it. And the president or the prime minister says, well, hang on, we've got to be consistent across the country. All sorts of challenges are going to arise, especially if those are political. And so, again, quoting Tedros, we do have to put politics into quarantine while we sort this stuff out. My second point is really responding to questions from colleagues in particularly Africa, who says, how on earth are we going to do all this if we can't isolate individuals because people are living too close together? How are we going to do it if we haven't got any masks? How are we going to do it if we haven't got any virus tests? How are we going to do it if we haven't got any PPE to protect our health workers? How are we going to do it if we haven't got any intensive care beds? How are we going to do it if our people are hungry because the lockdown means they've got no cash, no way of buying their food? These are so tough. I mean, sometimes we think Europe's got tough choices, but as I listen to colleagues talking from different parts of Africa or Asia and explaining how challenging this is to try to get on top of the virus, whilst at the same time maintaining life, whilst at the same time keeping what health services there are going. This is a time when people in poor countries are saying, remember, we are poor. Remember, we spend even 1,000 times less on healthcare than you do in the West. Rethink your recommendations so that they suit us. So we're getting those messages. And that's what we're really strongly trying to do. But I keep finding so many examples through our network of colleagues in 4SD and through other entities of communities just saying, we do know about handling horrible threats. We know that we have to come together and work together, and we have systems for doing that. You don't need to teach us that, you people from Europe or the US. We've been doing it for centuries, and we will use those systems. But leave us to do it our way. Don't you come and tell us how you think it should be done. And I think I've told some of you before, that was our learning when we were dealing with the Ebola outbreak in West Africa in 2014 and 2015. And it's the right way. So that's where our minds are at when we're more and more working with people from poorer countries, and we're trying to get it right. Meanwhile, we're in these conversations. Actually, we don't necessarily run the conversations, but we hear the conversations involving the International Monetary Fund and others talking about how they're going to create special money supply for poorer countries. And we just hope that in the economic action that will transcend these current waves of virus, that the interests of poor people in poor countries will be uppermost in the minds of decision makers. And then thirdly, I just mentioned it really, where you've got a lockdown and your community is poor, people in the informal economy, they don't have big money in savings. They don't have even significant bank accounts. They may have a mobile phone bank place where they store bits of cash, but they're not walking around with 300 or 400 euros or dollars or the equivalent in rand or whatever in their pockets, shillingi. What they have is perhaps just a few coins, perhaps a chicken or two they can sell, perhaps on one or two other things that they might be able to get some cash on. But by and large, they are only able to keep in stock food for 2 or 3 days. And we're hearing so many accounts now of poor people not able to buy food, not earning any money, sort of stuck in a limbo, not even in some cases in India, able to get home to their families because of transport being suspended and being really hungry. And so either they've got to be given cash, and there are schemes for doing that in India, there are schemes doing that in other countries as well, or they've got to be given food, both cooked food and raw food, but they need that, and they need it in a hurry. But otherwise, it will be impossible for them to continue to be in lockdown. Plus, there are all sorts of challenges because NGOs who support these kinds of situations are short of cash because their income has dried up. And there are issues when we go back to the farms, of farmers losing the markets for their perishable produce and not being able to get their stuff to where people will buy it. So there's some really acute challenges at both ends of the food chains. And then in the middle of food, the long food chains are being disrupted because of border controls and the like. So there is a lot of challenges to be addressed on food, and they are urgent. As with everything with this pandemic, if you stand still, then it really races past you. If you increase exponentially, it feels like you're standing still. You have to be able to jump in a synchronized way to get ahead of it. And I think there's a lot of sort of general understanding of the food challenge. And so I am joining a chorus of those who say this has to be taken into account. Thanks for the opportunity just to present all this. I'd like to now to acknowledge Florence on my right, and then the rest of the team of TWI, Julian, Catherine, Joe, Saber, and Magali, who are working with me on this. And I'd like to pick up particularly our colleague John, with whom I'm glad to say on my screen, he's right next to me. He's wearing a check shirt. Thank you, John, for particularly your help with the latest thinking on coming out of lockdown, which I want to share today. And everybody else in the team, thank you for your thinking on local realities, on the economy, on working in low resource settings, and other such things. I'm drawing on the collective efforts of our team as I make these comments, and thanking TWI particularly for her work in setting this up. I'm doing the thank yous now because what tends to happen is we run out of time. I recognize some of the people who are on this call. I'd like to greet you all and thank you for making the time to join. And don't hesitate to send a question. And I've seen one or two coming in already. If you would like, we will try to go very quickly to your questions. My length of answers on the questions is slightly proportional to the number of questions in the pile. So at the moment I have 2, and so I'm going to comment on these 2. And having just seen the first question, good. Thank you for asking that question. I'll read it to you. The pandemic is, not surprisingly, being politicized on various fronts. How would you advise WHO and the wider UN system to strategize accordingly? I think the most important thing that I'd like to start with is there's no such thing as an apolitical action within public health. It's the same as within food. It's the same as within most of the areas in which we're involved. To imagine that you can somehow operate without being inside the political context is really an ideal, and it's not a reality. If you want to try to shift the systems that come together to influence people's health, you have to be prepared to walk into contested space. And that contested space can get really, really sharp, especially when there are different political interests. And inevitably, any decision that is made will be incorporated into whatever political discourse there is going on in society. Now, what's interesting is that there are an enormous number of locations where political adversaries have realized that they have to have a ceasefire for the duration of this crisis. They have come to understand, perhaps through connections with their people, that the people believe that the threat posed to their well-being by this crisis, their health, their food security, other aspects of their lives, is just so great that they actually ask their political leaders to stop battling. And whether it's cross-party, as we hear in some countries, or whether it's collaborative or a coalition, or just simply a state of emergency, there are various devices that can be used by political adversaries to signal that they've decided that because the threat is so great, they're going to come together. And of course, as a public health person, that's always what I ask for. It's like asking for sanctions to be lifted when it's clear that there are people hurting as a result of the sanctions, without necessarily wanting to take sides in the war, but just acting on behalf of the people who are kind of the collateral damage. And we always do that. It's like asking for health facilities to be protected and not bombed. And so you give the coordinates of the health facility to the different sides, so they know perfectly well where there are sick people and doctors. And most of the time, they respect that and they don't attack. Because in our heart of hearts, we know that any kind of crisis like this, particularly one that is caused by an infectious agent, any cracks in our collective solidarity just make things worse. So we start from the position in public health of saying political divisions make life really difficult. Whether it's small p politics between different ministries or large p politics between political parties, it messes stuff up. But of course, everybody knows here today with me that just because you say that, it doesn't mean that that's going to lead to the political ceasefires. I mean, it's just the way, again, we are, that despite the fact that actually in their deep minds, political leaders know that to be in constant point scoring mode is actually leading to more threats for people, they will still go on doing it. And I mean, it's obviously something that for many of us is quite surprising, but it's a reality. And so, again, because we're approaching these as systems issues, we have to operate within that. So the question, I mean, in a way, the pandemic is not surprisingly being politicized. Yeah, it's not surprising, but it's frustrating. Simple. And the politicization is not everywhere. It's in a relatively small number of places, in my judgment. Of course, it doesn't stay constant. When people get a bit bored, or there are controversies, or the sort of sense of wanting to work together goes, then everybody gets back into fighting. And so, and I have to keep saying, you know, this degree of politicization varies from time to time. I think that things are a bit calmer in Britain because the Prime Minister's intensive care unit, perhaps. Things were a little bit calmer in India right at the beginning of the lockdown. I'm not sure how long that will stay for. So how does the UN system and the WHO strategize? That's the question. Answer. We must continue, I think, to be as clear as we can that our fundamental focus is on reducing the suffering of people everywhere, both from the disease and from the containment effort, whilst at the same time to try to create stronger capacity in communities and nations to deal with these kinds of problems in future. And that positioning is fine. But I do think that we also have to be aware that we are always going to be caught up in political turmoil. And that's part of life. And so how do I advise WHO and the wider UN system to strategize? Not to see this as something that is necessarily impeding our work, but to see it as just part of the landscape. And so the strategy must be to always work with the best available evidence, to always turn that evidence and interpret it into statements of risk with which politicians can, if they wish, inform their own decision-making. And then thirdly, to always behave as respectfully as possible to all parties. So it's evidence, that's the science part, risk, that's the interpretation part, and respect, that's the behavior part. Because the one thing we must never do is be seen to take sides. Now, when it comes to evidence, what we have to do all the time is to learn. this is a new virus. So we have to be learning from the experiences of different localities and then turn that learning into evidence. And that means listening to all countries, listening to all scientists, listening to all communities. And you can't do that if you've decided that one country is somehow not right, or another country is somehow not releasing information in a transparent way. You have to work with what you've got. And that is how the international system is. It's there on behalf of the whole world, but it's owned by the individual member states and their governments. They are the owners, you know, and they call the shots. But within that milieu, you have to be looking for evidence to learn from everybody. You have to be able to turn that evidence into risk assessments for everybody. You have to treat everybody with respect because they are your stakeholders. And you just have to maintain a regular rhythm of doing that, whatever the buffeting forces are. Because the world needs some group, body, entity to trust at a time like this. And right at the moment, what I would like to encourage all in WHO and the UN system to do is maintain that focus and ensure that people understand what you do and why you do it, and ensure that they can continue to trust you as the best possible source of authoritative guidance, of authentic support. And because they do report to all the countries, they will continue to be accountable. So anyway, let's just keep it going, but don't get disappointed and surprised because of politicization, because that is a reality. And I'd just like to thank all the governments and others who have found a way to actually have a ceasefire of politics and to get on and focus on this challenge. And that I'm seeing in the majority of locations, and I'm absolutely delighted. Number two, COVID-19 is showing the world that health systems investment is perhaps the key pillar of national, regional, and global socio-economic viability. Lessons of the past, like SARS, H1N1, and MERS, simply haven't been learned. Do you forecast that things will have changed this time, permanently, for once and for all? Thanks for that question. I have been asked a few times recently questions in the following style. David, you worked on avian influenza, you worked on H1N1, and you worked on Ebola. Do you feel that there has been sufficient learning from these experiences? And of course, the answer is, when it comes to being prepared for something, it's very hard to actually conclude on the appropriate level of preparedness, especially when what you're preparing for is super difficult for people to comprehend. So we used to say that we don't know when it will come, but we know that a major pandemic capable of slowing down the world will appear sooner or later. And we must get ready by anticipating what it might lead to and undertaking drills and practicing coordination within countries and between countries to minimize the threat. I remember the words, I've gone back actually and looked at some of what we did in exercises, particularly around the time of bird flu in 2005. And then we watched as after the crisis, so other things came along and the considerable needs of preparing for an unprecedented and major global event somehow got pushed to the side, to the back, to the edge of the priorities of different governments and different institutions. And inevitably, as people's time gets scarce or money gets scarce, these things at the edge get trimmed off. And, you know, you're reliant on, in the UN system, really on two things: on the views of the leaders in the UN, and then the views of the member states who govern, because they have to provide the money. And it was fascinating that despite all the evidence we had about the need for particularly global preparedness, actually the pieces that have been in place have been dismantled over the last few years for a mix of reasons. And that's made it hard for the lessons to stick. But I want to say one last thing on this one. Many of the people who were involved in these different exercises to get systems ready, who were involved in the reform of the World Health Organization's emergencies work after the Ebola outbreak, they are here. They are working together. They are using procedures and styles of working that we developed and tested previously. Very fast shifts in strategy, very fast changes in style of working, very fast connections between organizations. And that capacity to think hard, pivot quick is there. But I think that the missing piece is that countries all over the world, including Europe and the US, do need to have a much higher focus on public health preparedness at community level. That's the part that's really not received the investment it needs. Health budgets have been put more into hospital services, especially as populations have got older, and some of the public health capacity has not been built up in parallel and has not been also digitalized in the way that is perhaps needed. So, of course, I think things are going to be changed. I think after something as massive as this, as it was said by the Deputy Secretary General yesterday, the biggest humanitarian crisis that has existed in the whole time that the UN has been present, I think it has to change. I hope it changes in the way that we need it to change, which is getting health systems, particularly community health systems, better. In Europe, question 3, in Europe, we are starting to talk about coming out of lockdown. What do you expect to see in place if this is to be safe? Thanks a lot. Remember, lockdown is there for various purposes. One, to buy time to get basic health services ready so that transmission can be interrupted, isolation can be undertaken, and people and health services can be defended against constant threats of COVID-19. Number 2, to assist with the gradual deflation and suppression of outbreaks when they are very, very intense. So, no outbreak should be lifted until authorities are absolutely certain that in each community there is the capacity to defend against cases of COVID arriving and to stop them starting chains of transmission, to stop them leading to community intense transmission. So you have to have this capacity. I'm calling it now COVID ready, being COVID ready, but I'm describing it as having a constant community level capacity to defend against the virus. And it's going to need to be quite well established, and it will require some knowledge of who is sick, where they are sick, how sick they are, and what they're doing as they are sick. And this is going to apply, it's going to get more complicated, to people with quite mild illness in the respiratory tract. And it'll be really tricky because they won't all be COVID illnesses, but we're going to have that capacity to take respiratory tract illnesses really seriously. A bit like what had to be done with cholera 150 or so years ago, not got the year wrong perhaps, where suddenly dealing very carefully with fecal waste became a matter of life and death, as it was recognized that Vibrio could cause enormous loss of life. And so the whole approach to handling water, and particularly waste materials linked to water, had to change. And we learned to do it. We changed the way in which we lived by introducing sanitation. And the same is going to apply here. We're going to have to change the way we live, to have respect for this virus. And to come out of lockdown very quickly, we have to put these things in place. I know countries are saying, well, we want to come out of lockdown in 2 weeks. Okay, but if you haven't put the defenses in place in your communities, if your population isn't ready, if you're not able to get some rough idea where the virus is, then coming out of lockdown is going to be very dangerous. And so I think that all European leaders, sitting with their public health people, sitting with their people responsible for employment, are saying, how can we create sufficiently good defenses at the community level so that we will be able to manage this virus as a constant threat, whilst at the same time enabling our people to get back to work? And it will be being able to be defended against new big outbreaks of this virus. That's going to be at the center of what people are looking at. And I think they know they can't stay in lockdown forever. You know, some say, well, we stay in lockdown 18 months till there's a vaccine. You don't know if there's going to be a vaccine. And 18 months of this is really not feasible in any nation, certainly not in poorer nations. So getting that logic clear to everybody, defenses must be in place before you lift the lockdown, is something that I have become a broken record on. I'm saying it everywhere. Question 4. People are talking about therapeutics, tests and vaccines. Can you discuss for a moment the state of play on these biomedical technologies and what kind of changes, what kind of changes having effective tests, medication and vaccine will make? Okay, so this is a really sort of lovely question, and I wish I had a nice long time to talk about it, because if we unpack that, there's lots of issues. But let's start from the ideal. It's possible, let's say, this is an ideal state. There is a vaccine against COVID-19 that can easily be administered to everybody with no side effects, and it leads to constant immunity against the virus. And it's just there, it's there. We've got 8 billion doses available, and we've got everybody ready to administer it. That would be fabulous, and that would be the solution. And yes, that's what thousands of researchers are working on, and they're applying for a lot of money to do it, and it will change it. So that's the ideal. Next possibility. A lot of people have had COVID-19. They have got some kind of natural immunity. And so that means that they are creating a sort of buffer, and they're reducing the possibility for COVID to cause massive outbreaks. And there is what we might call a herd immunity in society. Well, that would make a lot of difference if after having COVID, people really do have the antibodies, and that really does defend them. But let's say we're going to go on without this broad immunity, without the vaccine, then we need tests to tell us who has the virus. We probably need another test to say who has the antibodies. And we need those tests to be available really widely. At the moment, virus tests are quite difficult to take everywhere. But if we had good virus tests, if we had good antibody tests, our job would be so much easier, because we would know where the virus is. So all these advances would have a massive impact. And if tomorrow it turned out that we had got a medication, low cost, that actually was guaranteed to cure people when they have COVID, that would be revolutionary. We're currently working without these, and it makes our task much harder. But I keep saying to myself, it could all change. So what's the state of play? On tests, virus tests are very hard to scale up. unless you've got the platforms. These platforms are being put together very, very quickly. They're big machines with reagents and trained staff. But it doesn't happen in just a week. It's several months. So improved testing, yes, possible on the virus. On the antibodies, it's just a matter of time before we get a good antibody test. And that will help us to understand who's had the virus. That make a huge difference. And the vaccine I've already described. So just at the moment, it's kind of a bit wait and see, but I'm cautiously hopeful on antibody test and on vaccine. Question 5, what can be done about the increase in food prices recorded in some countries? So there are 3 key factors on this food situation. Number 1, when situations get scary, anybody who's got food will hold on to it. It's just what always happens. Countries decide they're not going to export the food they normally export. They want to keep it because they're worried that suddenly the market might collapse or something might happen, not market might collapse. Suddenly there might be a shortage and they need the food for themselves. So there is withholding of exports. Then there is actually holding back in shops, and there's a scarcity. And so thirdly, there is the reaction to scarcity, which is automatically prices go up. And as far as I'm concerned, the only way this can be addressed is by actually offering cash or low cost food to poor people, because they're the ones who are hurting as a result of this. But if you try to force prices to come down by instructing shops not to raise their prices, you create a very, very difficult situation. Obviously, you need to stop profiteering, and a lot of governments are now doing that. They're putting a cap on how much prices can go up. But it's very difficult if you do that with too clumsily. Now, of course, offering low cost or free food to poor people has sometimes been associated with making it really difficult for people to get nutritious food and good quality food. There's often a thought that food that's given free is really not satisfactory. And so I would like to stress that we probably got to shift a bit and to talk about nutrition rather than food, and stress that the importance is to make sure that there is nutritional as well as food security of poor people. And I think that as a result of this question, I'm going to give that higher emphasis in my own work. I just want to stress, watch out for farmers. Some farmers are going to go bankrupt as a result of this because their markets are messed up. They need really a lot of support. They are, in some settings, as important as health workers because they're key to our future well-being. And more, I want to give shout outs for farmers right now. 6, to what extent is stronger worldwide coordination needed in health and economic responses? What major efforts are currently being done to this end? In our last open briefing, we talked about that, and I'd just like to summarize it this time. And I'm quoting Dr. Tedros yesterday. I don't know whether any of you saw it, but he gave a very interesting press briefing yesterday afternoon in which he focused on solidarity within nations and solidarity between nations. Solidarity is his, I think, shorthand for joined up working, and he sometimes said joint. So it's beyond coordination. It's actually locking together of strategies, because if you don't do that, stuff goes wrong. And in fact, I think that we have to say to this virus, which is a really dangerous virus, a stealthy virus, a surprising virus, a disturbing virus, it's all those epithets. But we have to say to this virus, you know, actually, we're not scared of you. And we're going to offer a united front with all our collective effort to push you back and keep you back, you virus, keep you out of our communities, keep you out of our lives. And as we've done with these nasty pathogens that are transmitted from feces to mouth, like cholera, we're going to learn to adapt our lives so that we can be living with you present, but we're not going to let you completely knock us off our stride ever again. But you don't do that through separate efforts. One city versus another city, one village versus another village, one country versus another country. No, it's nonsense. It's a global threat. So there you go. And you know, you can only lead and encourage unity if you're given the space to do so. And so we have this rather bizarre phenomenon in our world today, where communities have started to imagine that in the face of various threats, they're going to do far better if they just wall themselves off and look after themselves. And it's so attractive. If we can keep our community safe, we don't need to worry about anything else. We just create a wall and we'll be fine. This virus is a cleverer enemy than any I've ever known. It's invisible. And it walks around in people without you realizing it, without them realizing it. I'm just reading this morning some of the stories of some of the outbreaks in the US have been caused by people spreading the virus without being conscious that they're doing so. We have to have unified, science-based, collaborative responses, because this virus will exploit any spaces we create because we can't work together. So there are a lot of very, very, very experienced and serious people saying, come on, leaders, you've had your time, you've played around, you just got to work together. And Tedros yesterday directly said, if the US and China can't work together on this, then we're going to face much higher suffering all round. He called them out. Number 7, how can we support small and medium enterprises and the informal sector? And the question says in the developing world, but I'm going to say everywhere. You see, you do a lockdown to try to help build up defenses against this new enemy. You ask society to make enormous sacrifices so that we can at least get on top of it. The best thing we can do for SMEs in the informal sector is have world leaders come together and establish a united plan to deal with this virus and to work out how we, as humanity, are going to live with it. It's not impossible. It has to be done fast forward. It's got to be done, because pumping cash into supporting SMEs that are going bankrupt with enormous frequency is no good. If the moment lockdowns are released, there's going to have to be further drastic action, because we just haven't focused on what it takes to have a united front against this enemy. So the best thing we can do is to develop that united front to make sure that this unseen enemy is not allowed to come back and totally turn our lives upside down again. Strong defenses against the virus is what is best for the informal sector and SMEs. In the process, we need to do everything possible to keep them going, but there's a limit to what can be done with cash support. But given that cash support is necessary, I want to say, number 1, strong NGOs ready to work with people in the informal sector, because government doesn't easily reach people in the informal sector. That needs to be given a priority. Number 2, strong capacity to identify SMEs that are struggling and give them access to tax breaks, to low interest loans or cash handouts, and do it without regrets. And stop squabbling about who should be eligible, who not should be eligible. the collapse of SMEs is a disaster for life, for the majority of people. We depend on SMEs. Of course, we know the big corporations with their brands and stuff, but actually in life, we depend on SMEs. They are the bedrock of all society. They're the heart of care, they're the heart of food systems, they're the heart of law and order, they're at the heart of the fabric of society. And in the developing world, I actually think this is a big part of the global emergency, is the collapse of the SMEs and the total despair of people working in the informal sector who are going hungry as we speak. If anybody says thinks I've got this wrong, just tell me. But this is what I'm feeling in my bones right now. Question 8, there are real concerns about logistics and supply chain failures. We're already seeing this for smallholder farmers. What can be done to alleviate these challenges and avoid serious social economic consequences for this essential agriculture sector? I talked with the president of the World Farmers Association, World Farmers Organization yesterday, which brings together all the different farmers. And who knows, he might even be on this online briefing, just perhaps. And I was just thinking to, as I was talking to him, you know, on one hand, this is a really good opportunity to rethink how ag and food really works and whether it does respond to our needs, whether it does create livelihoods, contribute to the environment, and also offer nutritious and healthy food. So yeah, let's recognize that. But now we have to just start talking about and focusing on the reality of the challenges faced by smallholders and have that into our thinking. And yeah, agriculture sector is key. I might come back to that if there's a moment at the end. And if Teo is here, I might unmute his mic. Can you please expand on the links between nature, nutrition, and health? When I was working with the World Health Organization in 2005, and we were focusing on the arrival of bird flu from poultry into the human population, particularly in Southeast Asia, but then it became global. And we thought, well, is this going to be the next pandemic? And we started to get ready for it. What we learned was that human health is intimately connected to animal health. Animal health is intimately connected to the health of what's happening in the environment. These are interlinked realities. We used to call it one health, and it's also one nutrition. And so I'd like everybody to be conscious that it's no good dealing with these areas as separate boxes. Health, nature, climate, food, they are totally interconnected as a spectrum. And that is really important. I've got my 10th question now. I'm checking the time. We see in some countries the risk of government COVID-19 response plans with little or no mention of other key topics. That's a segue from the last one. Yes. Little or no mention of other key topics such as nutrition. How can we support countries to come with harmonized, multi-sectoral response strategies? How do we need to shift our way of working to support them? Well, there's a good thing there because of the we. I'm thinking the we probably is the international community. And so I want to start really from my own experience of working with communities in different parts of the world. In the communities I worked with when I was a medic, a real medic, that means, I found people, you know, they automatically joined up issues of health, food, water, security, shelter, jobs. They saw these as a great big melange of issues that they had to navigate all the time. They probably weren't comfortable with words like systems, but they certainly said everything is joined up. Tout est mélangé. Or somebody chose Jamagarakucha, which is another language I speak. And so I think that it's not the problem of people working at local level, this compartmentalization. The compartmentalization comes from the way in which society organizes knowledge, organizes action, government departments, university disciplines, professions. That's where the problem lies. And then you've got people finding money, and they put labels on it saying nutrition, health, agriculture, security. And you have to put the money on different things. That's where the problem comes. And so I just think that if we can stick with what we learned through the negotiations of the Sustainable Development Agenda, if we can stick with what we're hearing from people, that actually separating stuff up into little boxes just creates a big mess, that actually strengthen communities to be able to deal with threats, includes health threats, includes climate threats, includes threats due to things going wrong in nature, it includes threats of loss of livelihood, and to be joining up this sense of defense and strength and resilience is the only way to go. And the problem is not what's happening in the countries, the problem is us when we look at stuff. Theo, are you there? And would you just be prepared, if I can unmute your mic? Yeah, you are, you're unmute. This is the president of the World Farmers Organization. Just give us a couple of minutes before we close on your view of the food situation from where you're standing. I suspect you're quite a long way away from me. Greetings to you, Theo Diego.
Thank you very much, David. Can you hear me?
Oh, no, it doesn't work.
Can
you
see if I can unmute. Yes, can you hear me? Can you hear me, David?
Oh, I see. I turned off my speaker. Hello, Theo.
Can you
I
hear
hear
me
you
now?
are. Just give us a couple of minutes before we close.
Thank you. Thank you. Well, first of all, thank you for the remarkable job you are doing. Come at the hour, come at the man. We really salute you. And as farmers, we are very excited for the fact that whilst you have spent such a long time and a large part of your life researching food and nutrition systems, you now land in this position where you can make that connection between health and food. From the farmer side, you know, the future does not seem what it used to be. Farmers are really very nervous as to where things will be steering, because we always work with the future. We plant today to be able to harvest in a few months from now. We plant fruit today to be able to harvest in 3, 4, 5 years from now. So whatever we do now will be determined in what our markets will look like in the future, what society will look like in the future. And in many ways, this coronavirus came as a kind of a reset button for our whole food system. So we have a few wishes, if you want. We wish that when we come out of this, we will come out with a better chance to create a more fair and equitable food system. We wish that when we come out of this, the world will realize that it is actually possible to create within our lifetimes a world without hunger. And when we come out of this, we firmly believe that the world will have a different view as to where food comes from, and appreciate the role of the primary producer in the food systems. Having said that, we are in the fortunate position as farmers to be a bit more away from the masses. We are, in a sense, we feel a bit safer because we are not there where masses of people can infect each other. And our businesses usually goes on. In most countries, we are excluded from the measures, but we firmly believe that the biggest risk this virus poses is not for infection. It is what it will do to food security on a household level, especially in poorer communities and poorer countries. We fear the day when poor families run out of food and they simply go to where the food is, and no window or door or wall will stop them from getting there. Hence, we are calling on governments to stop this thing before it starts, to actually invest in getting food into those communities who need it most. And while many governments say, we cannot afford it, do you know what it will cost? We want to ask them, have you any idea what it will cost not to do so? And it's not only on that end, you alluded to the other end too. We need to get diesel and seed and fertilizers on farms. If farmers do not plant now, there will be nothing to eat in a few months from now.
Teo Diego, President of the World Farmers Organization, thank you for those remarks. Everybody, we are collectively facing some massive, massive issues all over the world, but there are people with ingenuity, people with foresight, who can advise us as to where to go. Teo connects with hundreds of millions of farmers all over the world, and he can, I think, give us witness as to what kind of issues we need to deal with. Thank you all for joining us today. My final comment. The world realizes that there are a lot of frontline workers who are key to our collective survival. They're health workers, they're farmers, they're cleaners, they're carers. And there are many more groups who we could add to that list, who enable us to access what is essential to life. They're people who are not valued as they should be by society, yet they are vital. In each of these areas, the majority of the people who do most of the work are women, not men, women. Women farmers, women health workers, women cleaners, women carers. They're very poorly paid. And so perhaps, as Teo said, this will lead to a reassessment of what really matters. Perhaps it will lead to a revaluation of the people who really are essential for our future, a revaluation of the contribution of women, and a revaluation of the importance of the social fabric for the future of all of us. With that, at afraid 2 minutes after the hour, I want to stop, but I'm very moved by what we've discussed today. I think we're all moved by it. And I thank you very much for being with us and for being part of this and for sharing your ideas with us on this briefing. We will go on doing open online briefings. Do encourage your friends and colleagues to join if you think it's useful. Do share with us your ideas of how we can make this more useful, even if only one of you, as a result of this, feels inspired to go and do more, to try to create a situation that is better for as many people as possible. Even if only one of you, that's a success for us. We're committed to supporting you as much as we can. There will be a recording and there will be a video, recording of the video available online. We have all sorts of challenges with the internet being slow, but we do that. We have narratives that we're producing, and we'll try and put one together to capture some of the points that Teo raised. I hope that he'll give us some words quick as possible to put into that. But most of all, please stick in there. Each one of us is going to have a role in determining how humanity comes through this. The thing is that none of us will ever truly know what contribution we made and its impact. All we'll know is that we were part of the effort, because it will be something we do together. Bye. Thanks to the team. You're fabulous. Fabulous. And thanks to all of you. Bye-bye. I enjoy this. It's great.